OhioHealth Sports Medicine, getting you back in the game faster. Get in the game, ohio.com.
Hi, I'm Dr. Joe Ruan, team physician for your Columbus Blue Jackets, and welcome to this segment of Get in the Game. Today we're going to talk about a rather common but poorly understood hockey injury, the sports hernia. We're lucky to have Stinger here again with us to demonstrate some important principles about sports hernias. A sports hernia can happen when there's a sudden, forceful extension of the abdominal muscles, such as in a hockey collision. The player feels a sharp pain in the lower abdomen and thinks maybe they just pulled a groin muscle. It becomes very difficult for the player to skate. A typical groin muscle will get better in about 1 to 2 weeks, but this one can linger for months. That's when we become suspicious that this may be a sports hernia. A sports hernia is caused by stretching or tearing of muscles deep in the abdomen. This injury can cause pain anywhere from the lower abdomen to the upper part of the leg. This actually makes this injury rather difficult to diagnose. There is no specific test to diagnose a sports hernia, and that's why it's good to see a sports medicine professional familiar with these injuries to help diagnose this problem. A good way to help prevent sports hernias is to keep the core muscles of your abdomen and back rather strong. Here we see Stinger demonstrating the abdominal crunch, a very important exercise for maintaining a strong core. Notice how his feet are flat on the ground, and he doesn't have to come all the way up like we do in the old traditional sit-up. This is a very effective exercise for the stomach muscles. Stinger is going to show us another exercise to help prevent groin pulls that can happen in hockey and other sports. As you lift your leg up, you are strengthening the adductor muscles, which is the muscle most commonly involved in the groin pull and often overlooked in a lot of strength training programs. Once a sports hernia is diagnosed, this is actually one of those injuries that an athlete can play out the rest of the season with a little bit of pain as long as it's not affecting his function too much. Sports hernias can take weeks to rehabilitate. Once in a while, surgery is necessary. The good news is it's often very successful. Thank you for joining us for this OhioHealth Get in the Game segment. Be sure to check back soon when another team physician from your Columbus Blue Jackets help you get back in the game.
OhioHealth Sports Medicine, getting you back in the game faster. Get in the game, ohio.com.